Hello, first year faculty team. Welcome to our 12th week in the semester. We are really moving right along with really just 4 weeks left in clinic. Some things for this week to be aware of. On the SARP, just a reminder, the students should only be checking the services that are performed on the patient that day when they do that day's SARP. So the services could be performed by either the student or by a faculty member, but only mark the things that were due that day. So we're not going to mark vital signs, for example, at every single appointment because they were only done on the first appointment. So you don't need to check them. The student doesn't need to write was completed, earlier. Just leave those blank because the SERP itself is reading as one long document. So all three of those are really, it's like one long SARP with three different dates. Please remind students at the end of clinic to restock their units, to take a look and see if anything needs to be refilled. And then one other thing, you may or may not see this, but if you happen to see a student who's taking bite wings or on the bite wing portion of their FMX, some of the students have been using the wrong bite block. They've been using the vertical bite block instead of the horizontal, and they're breaking those vertical ones. So if you could just take a quick look and make sure that they're using the horizontal one, or before you send them off to take x-rays, if you could remind them to select the right one, that would be really helpful. Students have 3 skill evaluations due this week: calculus on a mannequin, fluoride varnish, and polishing. Most students are completed with those, especially Group C. I think they're done. And then we have a few students in Group D who are going to be completing those this week. For students who were not able to get to calculus section on a mannequin before this week because they didn't have patient cancellations, I am setting the mannequin up for them in opposite clinics so they have the opportunity to get that completed without being penalized. Last faculty note is on the blue notes. As usual, try to do the blue notes in order as best as possible for when students sign up. However, if it's necessary to skip or to kind of jump over a student for a final skill check or something that takes patient priority, it's no problem. Just communicate that with the student who's been skipped. And then when you put blue notes in sequence order, just remember you start at the top of the sequence and then work your way down. That's the order that the blue notes go. So start at the top and work your way down. That's all that I have for you this week. I hope you have a really great week. If there's anything I can do for you, please do not hesitate to reach out.